My name's Dr. Oliver Johnson, and for the last few years I've been working with the King's Sierra Leone Partnership as part of the Centre for Global Health at King's College London. I'd always been interested in global health growing up because I travelled a lot, but being at King's College London really nurtured that. I was part of a student community here that was very international, but I also realised during my clinical rotations about how important global health is to being a good UK doctor. I was very involved in Amnesty International, in the Medicine International Students Network. So there were so many skills that I learned about organising events, about campaigning, about volunteering, that I now use every day as a graduate. So I think it's always important to remember that being a medical student is much more than just your pure studies. It's about the location you're in, it's about the community that you're part of. And King's, being in the heart of London, is a fantastic place to be a student for that reason. King's is different to a lot of universities because it also gets out into the field. So for the last 15 years, King's had been working in northern Somalia and Somaliland, and I started to understand that I could also have a role in working internationally for the university. I first arrived in Sierra Leone in January 2013. To begin with, it was just me, but pretty quickly, some other King's graduates came out as volunteers alongside me, and we started to build relationships on the ground. So we worked to try and strengthen the emergency department, which hadn't existed at the main hospital up to that point. We worked to try and help them develop their medical curriculum, to improve the way that they were teaching and learning and doing examining. We worked on mental health, and we started to try and support the first generation of mental health nurses and the first trainee psychiatrist in the country. I went out, supported by King's, to develop that partnership, initially to help strengthen the health system, and then later became very involved in the King's Ebola response that stayed throughout the outbreak in the capital city. King's was fantastic in providing us the logistical support to arrange flights to get insurance. The hospitals opened up their stores to help ship out aprons, gloves, the protective equipment we needed to stay safe. And we were able to draw on some of the senior expertise around infectious diseases, viral hemorrhagic fever, the mental health of our own volunteers and patients from across King's to get the highest level of technical support throughout the response that King's put together on the ground in Freetown. It's essential in today's environment to take a global approach to health because we live in a completely globalised society. So that means that technological advances, research, but also patients are moving around the world. Doctors are going to spend a lot of their time and their careers working overseas, studying overseas, but the patient community in the UK has become so diverse. Different risk factors from different cultures and different ethnicities. I want to keep a relationship with King's throughout my career. So I don't know where I'm going to go next. I hope I'll work back out in Africa on the ground with governments, with non-governmental organisations. But I'm planning to keep a relationship with the university so I can keep coming back, keep working with students, keep doing research into the very long term.